Hello, everyone. Hi. Hello. Look at that. Love some audience participation. My name is Eugene Daniels. I am a political White House correspondent and playbook co-author, and I am very excited to be here, talk about something other than criminal investigations, fights on Capitol Hill. Instead, we're here to talk about a very uncomplicated issue with easy answers and agreement across the board. This will be fun. But in all seriousness, welcome to our panel, Polling the Pollsters. As the campaign heats up, and it is quite hot, I can tell you, pollsters want to know what most concerns voters and whether those concerns will translate into political engagement, especially in battleground states. We probably all want to know those same things. So they have been polling and will continue to poll key voting groups, including women, about their priorities and asking about healthcare affordability and abortion access and how that affects their decisions. We will discuss the change of collecting accurate information and why the polls don't always get it right. I'm a little scared to say that around the post. So we'll see what kind of tussle we get into up here. I want to quickly introduce the panel. From all the way over there, we have Mollyann Brodie. She is the Executive Vice President and COO at KFF and Executive Director of its Public Opinion and Survey Research Program. Jennifer Agiesta is the Director of Polling and Election Analytics at CNN. Working from CNN's Washington Bureau, she leads the network's polling team, which both conducts and reports on polling, and also heads its election night decision desk, so no stress for her job there. Emily Swanson is the Director of Public Opinion Research at the AP, where she directs their polling team and election night decision desk. We will be taking questions from you guys toward the end, so don't be shy. You know, we have people running around with the mics. Throw your hands up and we'll get to you. Mollyann, I want to start with you because you guys have some breaking news over at KFF. Brand new polling out this morning where you surveyed more than 3,000 women. We're going to get through some of the findings throughout the panel. But overall, how are voters thinking about health care as we get closer and closer to actually voting?
Great, thank you. I think it is fair to say this is not a healthcare election, right? There are a lot of other issues on voters' minds. We're talking, at least at the presidential level, about two incumbents, so people know them well. But with that said, and given how close the election is, we know that the outcome is going to come down to a small number of votes, and those votes can come from a lot of different places. They might come from some battleground states. They might come from a particular group who decides to turn out to vote or not. And they might come from some of the key constituencies. And I think that's where healthcare really can make a difference this time. When we talk to voters, certainly what they tell us is their top issue is inflation, costs, and prices. But when we follow up with them and we say, well, what do you mean by that? The number one thing they tell us is, it's the cost of my health care. I am most worried about my prices. I am worried about what I'm paying for. So this is a way where the more the candidates in campaigns talk and tie the cost of health care to inflation and people's worry about prices, the more that kind of healthcare voter will come out. The second big way, which again goes with our breaking news because of our new survey today, is the role of abortion in this election. Since Roe v. Wade was overturned, the politics of abortion, particularly in election context, has entirely switched. For years and years and years, probably the entire time we ever did polling, the abortion voter in an election, the motivated abortion voter, was much more likely to be a Republican, anti-choice voter. But since Roe versus Wade, that energy has completely shifted. And we know for a small group of voters, abortion is their key issue. That small group of voters is a very important demographic in this election. It's women, and it's particularly young women, and it's particularly women of color. So we have an issue that is on the ballot in 10 states, and we know from some of these other elections that we've had since the Dobbs decision, that when abortion is on the ballot, it has changed sort of the nature of turnout. And so I'm hoping we'll talk more about that as we go on.
No, absolutely. Jen, one of the findings of the poll is, quote, any path to the presidency for either President Biden or former President Trump requires maintaining the support they received among segments of women voters in 2020 and gaining votes among other groups of women voters. Now, it's super simple sentence there, but really struck me because what it says is many of the fundamentals of this election have actually never changed. So I guess, what does that tell you about the current electorate and how they're viewing the election?
Yeah, I think it's been really interesting in that we've had an extremely stable set of polling on this election all the way through thus far. And underneath that stability that we've had the entire time it's been clear that this rematch is going to happen, you have sort of these groups that are sort of behaving a little bit differently than they might have in past elections. You have younger voters who are looking a bit less democratic than they have in past years. You have black voters who are maybe a little bit more Republican than they might have been previously. And then the same thing is also happening in some polling with Latino voters. And what I found interesting in some of our polling is that when we looked a little bit more deeply at people who say that healthcare is an extremely important issue to their vote, groups like that are the ones where it kind of pops a little bit. Relatedly, at the same time, President Biden's approval rating for handling health policy-related issues is a little bit higher than his overall approval rating. His ratings generally are pretty negative consistently in most polling. But this is one where it's higher. And the gap between his approval rating on the economy and his approval rating on healthcare is a little bit bigger among some of these subgroups. So young voters, black voters, Latino voters are more likely to say they approve of Biden on healthcare than the economy, and by a wider margin than the overall pool of registered voters. So there's an interesting opportunity there, I think, for a messaging effort from the Biden campaign to bring people around on these issues, should they be able to make them a little bit more of a motivator, which is a lot of what Molly's data speaks to.
Yeah, and also, I've been covering the White House and the campaign since the beginning, and what they will eventually cop to is that they've struggled with messaging, right? Mm-hmm. And Emily, I'm wondering, especially when it comes to the healthcare wins that President Biden has done, he talks about $35 insulin for seniors all the time. He talks about wanting to protect earned benefits all the time. But when you talk to voters, they don't hear it, they've never heard it, they don't care. I've talked to people who've done focus groups with black voters specifically, and they say when you tell them the wins that the president has gotten, then they're more interested. So I guess, what do you think the messaging gap is between what they've actually done, them saying it, and voters actually hearing it?
Yeah, that's a really interesting dynamic in this election, that there are in a lot of cases, and it's for some of these healthcare wins, it's for climate policies. When you ask about certain aspects of the Biden agenda, people will largely support it. Majorities will say that this is a good idea. They favor this. They approve of what the administration is doing. However, when you ask them about Biden's accomplishments, they don't feel like he has accomplished a lot. They don't feel like that those accomplishments are really hitting them. And that definitely goes for prescription drug costs and some of the work that they've done on getting those paid for more Americans. These are really popular policies.
Negotiating drug prices.
Exactly. We did some polling recently, back in the spring, asking people how they felt the Biden presidency so far and the Trump presidency had impacted a variety of policy issues. And really across the board, almost universally, people said we're more likely to say both presidencies actually hurt than helped on a wide variety of policy issues. That's exactly right. And it was, for both of them true, actually, for cost of health care, that people were a little bit more likely to say that their presidencies had hurt than had helped, although it certainly wasn't the worst issue for either of them. The worst issues for Biden were definitely immigration and the economy. And I think that that actually goes to one of the things that you asked about, which is why aren't people paying attention to those specific policy wins? And part of the reason is that it's all sort of subsumed into this anxiety about the economy, worry about inflation, continued worried about inflation, and that just kind of sucks the air out of the room a little bit on some of these policy issues.
And can I add just one more thing on that? So the other thing we have to remember is that those wins on the IRA in terms of the Inflation Reduction Act, in terms of the these new policies that would actually help with prescription drugs were really just targeted, it's the Medicare program.
Right.
So it's really just the people who are on Medicare, seniors age 65 and older. And what we've seen in our polling is, yes, the vast majority of Americans are not aware of this at all. And even the majority of older voters aren't aware of it. But their awareness of those wins has grown as the campaign has started talking to them. So this is where the whole idea that we are 6 months out still, and like it's too early to tell, and there's a lot of things that'll happen.
And this is an excellent point. Actually, older voters are a relatively better group for Biden, even though younger voters have tended in recent elections to be a stronger group for Democrats. But Biden's approval rating has slid more among younger voters than among younger adults than among older adults. And that could be one of the reasons why.
Yeah.
Yeah, I mean, it's interesting. The campaign clearly knows that. Just last week, they started older voters for Biden, and so really leaning into that. Jen, one of the things that I have found really interesting is when we're talking about, people not knowing things. What progressives have told President Biden and the campaign and the White House is that they have to give them an enemy. Right. And so in the president's State of the Union address, they got a line in there. They're very excited. It's a very long speech. So you get one line in there. It's very impressive. You can go to your boss and you get a raise, I'm assuming. But one of the lines that they pulled was essentially, we want to protect your earned benefits and protect your health care. Republicans don't want to do that. And so it feels like it's simple. And so as you guys are polling folks, does the simple message win out, or is it do people want to hear about the exact policies?
I mean, there's always a divide, I think, in polling where people say that they want to hear a lot of policy specifics, but when you do, campaign pollsters, political pollsters, when they're doing more message testing research, the simpler message does tend to win out.
And the negative message often.
Yes, and often the negative message. So finding the right combination of things that's going to reach the voters on this specific set of issues is kind of, I think, the challenge that they're running into. That stability that I was talking about, I think, comes in part because people just aren't fully tuned in. As Molly was saying, people who kind of know more about it are kind of shifting a little bit. But I think that we're really at a very early stage. And I think when you combine that with the overall sort of let's call it distaste for this combination of candidates. You have such high unfave ratings for both of them.
We've been calling them double haters.
The double haters are a pretty
campaign
big
likes
group
that
at this
term.
point. I mean, way
Surprisingly.
bigger than they were in 2020, way bigger than they were in 2016. So I think that is sort of making it a little bit harder for any message, however it's formulated, to break through with voters at this point.
Yeah. Mollyann, one of the things I find so interesting about healthcare is you say the word and you probably to 10 different people, you can get 10 different answers on what you mean by that, right? Some people will talk about Medicare. Some people will talk about hearing aids. Some people will talk about insulin or some other shot, maybe Ozempic. Some people will talk about abortion access, right? And mifepristone. And so for everyone, what are the through lines that you guys found in this polling for people who you've polled recently or in the past?
Yeah, I do. I mean, I go back to healthcare affordability. I mean, I've been doing this a long time. In every election, it's an economic election. Okay, well, what do you mean by economy? Well, I mean my healthcare costs. When you talk about healthcare, okay, well, what do you mean about healthcare? I mean my healthcare costs. And people see those healthcare costs. They fear them. They fear the unexpected medical bill. That's the top worry when it comes to when we ask people about their things they're worried about paying for. At the top was unexpected medical bills, which really surprised us. Even though people are having trouble paying their food bills or their gas bills, what they're really worried about is the unexpected medical bill. So I think that's a through line. And one of the things about that is a real bipartisan answer. I mean, there's not a lot of things these days where Republicans, Democrats, and independents agree on, and they definitely agree that their biggest concern in healthcare is the cost of healthcare and the continued cost of healthcare. So that's the biggest through line. And then again, some of these other issues, we see, I think there's a real opportunity. Also, the public really has a lot of these big public programs, so Social Security, Medicare, Medicaid, they are very popular with people, and they serve a really important need for people, and people have a lot of fear about those benefits and those entitlements going away. So that's another through line. That's another one where you see kind of all partisans agreeing on that.
Yeah. On that last point, Emily, you have Republicans who, for years, have talked about figuring out how to dismantle earned benefits in some way, right? But then now they're having a completely different conversation, right? Because voters, after COVID, after getting more benefits from the federal government, getting some of those checks and those accounts, they've kind of changed the way that they think about what should the government do for me. Mm-hmm. And I guess as we're thinking about the election, how much does that factor into it? Voters changing their minds, and you're watching officials try to chase after them, which is not typically how at least the Republican Party has operated.
Well, it's actually super interesting. Molly mentioned at the outset that this is not a healthcare election, and we've seen in polls that have asked about the most important issues facing the country. For example, we do a poll every year, once or twice a year, where we ask an open-ended question about what are the top 5 issues that you think the government should be working on. Completely open-ended, let people say whatever they want, and then we analyze the data to see what they are. And heading into 2020, and this had been the case for many years, close to half of Americans said healthcare as one, or a healthcare-related issue, as one of the things that they were wanting the government to be working on. Not necessarily their very top issue, but one of those top issues. And it's very interesting that right around the time of the pandemic was when that kind of went away. Now our polls, our most recent one heading into 2024, showed it was closer to a quarter, so roughly half of what it was previously. That's still actually pretty high, is one thing that I will say, compared with some other issues. But to some extent, it seems as though COVID, obviously a healthcare issue, is the thing that sort of took the wind out of the sails of healthcare as an issue, but many of those policies to help address COVID, especially when it came to how people related to the healthcare system, were quite popular. People liked having their COVID-related healthcare taken care of by the government. In terms of why Republicans aren't talking about it, I mean, I think that it's a net benefit probably to Republicans that this isn't the big issue that people are talking about, because like Jen mentioned, people who do mention healthcare as a top issue tend to be people who are voting for Democrats. And it's an issue where some of those groups that are potentially not enamored with Biden's performance, if they're sort of keyed into thinking about healthcare, suddenly that becomes a little bit more of a net benefit to Biden among those sort of core Democratic groups who are potentially thinking twice about supporting Biden again.
Yeah. Jen, we've talked a lot about President Biden. Former President Trump, also running, will be the nominee for Republicans. I hear what you guys are saying about the voters that really care about health care are more likely to be Democrats, more likely to vote for President Biden. However, one of the things that was in the poll is that Republicans said that in the KFF poll, Republicans said that they were more likely to vote on issues. Like these Trump voters said they were more likely to vote on issues, and Democrats said they were more inclined to vote based on candidates' character. which when you talk to people and you deal with reality and the kinds of former President Trump doesn't. He would even say this doesn't have a lot of strong stances on policies, right? He has a couple that he talks about a lot, immigration. He waffles. He's kind of all over the place on abortion right now. And so I guess as you're thinking about how he's messaging and how he is trying to change a couple of things, the way that he talks about earned benefits, about abortion, how are voters viewing that? Or is it even comprehending for them?
Yeah, I think it comes up in sort of this retrospective view of how he actually handled the presidency. One of our sort of more notable findings this past spring was that a majority of, I think this was Americans and voters, now consider President Trump's time in office to be a success. And so I think that they see what he accomplished, what he did as president, as a net positive for him. And that may be what voters are reflecting on when they're saying they're backing him because of his stances on issues, his positions on policies. The voters who back him are looking for him to be able to carry forth the policies that he's talking about, and they think that he did a decent job of that in his first round of time in office. And so I think that that is the major motivator for them. And you're seeing that sort of issues related to character are not really moving the needle in the way that they may have in past cycles. I mean, I think that's been true regarding President Trump specifically for most of the time that he's been politically active. You know, normally, if a candidate is, convicted of a crime, indicted, that's kind of the end of a political career, but that has not been true for him. And he continues to hold on to their support because they see such benefit in what he has been able to accomplish.
Is it normal for voters, for Americans to, after a presidency, view it in a different way, right? Because the same thing happened with Obama and the Affordable Care Act, right?
Absolutely.
Like all of a sudden, you saw Republican states being really excited about what you could get out of the Affordable Care Act. And when it was called Obamacare, they weren't so happy. When he was in office, they weren't so happy. Is that consistent through almost every president, or is President Trump different here?
That
Any
is
of you?
almost always the pattern. But it's unprecedented that we have a president running again after losing. So that kind of changes the equation a little bit. But typically, if you look at Gallup, has great historical polling on this for many presidents going back in time. The sort of best example of it is George W. Bush left office with what were at the time the worst approval ratings that a president had ever gotten, and even his time in office is viewed positively now in retrospect.
Yeah,
And Jimmy Carter.
And Jimmy
Jimmy
Carter. Yes.
With Bush, now people see him as like the painting grandpa. It's very different. I want to shift over to kind of abortion and reproductive access. Mollyann, over and over and over, we've seen abortion referendums or candidates who run on defending abortion win. It's happened ever since Dobbs overturned Roe v. Wade. My colleagues, shout out to my colleagues who broke that story a couple months before it actually happened. There are a bunch of reasons why that's the case. And are we anticipating, as we're looking at the polling, because like the fundamentals aren't changing, that seems like it's not going to change. That's going to be the same concept in November, and you guys found that in your polling.
Yeah, what I would say about it is, as I said, the politics of abortion, and particularly the politics of election around abortion as an election issue, have shifted dramatically since Dobbs. And it is now a motivating factor. And I think one of the things we haven't said explicitly, but we've been implying it, is that given that we have these two candidates that everybody already knows so well, and quite frankly, many people aren't so excited about, this is really a case of who's going to be motivated enough to actually bother to turn out and vote. So we're really talking about turnout as kind of one of the most, it's always important, it's always the only thing that really matters, but this time probably more than kind of ever, it really matters who decides to take that step and actually fill out their ballot and do it. So in the states that have abortion on the ballot, what we're seeing in our polling and what we saw in the big release today is that those voters are much more likely to tell us that they're more motivated to vote this time than before, the Democratic voters, and they're more likely to tell us that they're absolutely certain to vote. In states without abortion on the ballot, the Republicans are more likely than the Democratic women to tell us that they're certain to vote and that they're more motivated to vote. So it definitely seems to be something that may really do what it has done in these other cases, which is bring out a different electorate, an electorate that is less regular voters and more likely to be younger voters who kind of come in and out. But I do want to make a caution from our survey today. So one of the things we did on purpose is, you talk about battleground states, and it's like, if you look at one battleground state, that is one battleground state. So sometimes we have to push them all together. But really what we did is we did big samples in Arizona and in Michigan. And the reason we picked that is, if you all remember, a few years ago, there was an abortion ballot initiative that really brought out this different kind of electorate picture, and that not only in Michigan, this is in Michigan, not only pushed for the abortion rights to pass, but also helped carry in the Democratic governor and a whole Democratic House. So they switched the whole politics in Michigan with this ballot initiative. We wanted to go back and to see, are all those voters still motivated? They came out, they got excited, they had this big shift. And what we found in Michigan is that abortion is no longer a motivating issue. Michigan women tell us that the issue is settled in their state. And what they're primarily concerned about is inflation and the economy, which, as we've heard, is not where President Biden does as well. So Michigan is now a very different sort of politics situation than, say, in Arizona. So in our Arizona data, where abortion is on the ballot, that is where women were much more likely to tell us that they're going to come out and vote for it, that they would be more motivated to show up to vote if it was on the ballot. And it is where it sort of it cancels any enthusiasm gap that the Republicans are ahead of in many of our polls.
And if I could add a little bit on that, it's really instructive to see those data and how they might play out at the presidential level. But it's important to think also about the effects that this might have down ballot. Yeah. Arizona is one of the states that also has a critical Senate race for control of the Senate, control of the House. They're very closely divided right now. And some of the states that could potentially have abortion measures on the ballot this year are very important in that regard, even if they may not be critical battlegrounds for the presidential race. You look at like a Montana on the Republican side or a Maryland on the Democratic side. So for the full complement of all the federal offices that will be elected this year, that could have really big ramifications.
Yeah, I mean, one of the things that's been so interesting, and when you talk to Republicans, they'll never say it in front of the camera out their own mouths, but what they'll tell us on background, as we call it, is that they have at times overplayed their hand, or at the very least, something that they're not used to, have differing views throughout the party, right? Typically, the party is like very on board with one message. And when you talk to the folks in Washington, D.C. on Capitol Hill, the operatives, they are trying to moderate in many ways. You even see former President Donald Trump trying to moderate as well, while you have the advocates in the space, right, being like, no, we are going after IVF. No, we are going after contraception. I don't know what you're talking about, but that's what our plan is. And so, Emily, talk about that lack of a consistent message and how it's made for maybe a more interesting conversation for those of us that watch all of this.
I think it was Mollyann who mentioned earlier, or maybe it was Jen, that abortion used to be for people who were abortion voters. Those were Republican voters. There weren't necessarily a ton of them, but for people who were super motivated to come out on that issue, they were Republican voters. The fall of Roe really changed that a lot, because suddenly Republicans were in a position where those voters who used to be single-issue abortion voters wanted them to do what they were electing Republicans to do, which is to really dramatically scale back abortion access, if not eliminate it entirely. However, that's a really small minority of people who want that, who want complete abortion bans. So it put them in a little bit of an untenable position, that the people in their party who historically had felt most strongly about that actually did want that, but the majority of voters and even the majority of Republican voters were suddenly faced with, hold on, no, I don't want a complete abortion ban. I don't want abortion to be banned in cases of rape or incest, or when there were serious fetal health risks or serious risks to the health of the mother. They also tended not to say that they wanted bans super early on in a pregnancy. So it started to highlight the amount of nuance that there is among not just Republicans, but all Americans in their views of abortion. One thing that's been true for a very long time, even in the sort of very simple questions that pollsters ask about abortion, like, do you think that abortion should be usually legal, or always legal, usually illegal, always illegal? Relatively few people fall on either of those polls. Most people fall somewhere in the middle. And when the discussion about abortion suddenly shifted to bans, that is what put Republicans on the defensive. And I think it's one of the reasons why, for example, in this year's Republican presidential primaries, these sort of strongest positions on abortion that you saw were along the lines of a 15-week national ban, because probably that's about where you get to the point where at least it's not a net negative among Republicans. So that really speaks to the challenges Republicans face on this issue.
I also want to add, we, in one of our more recent polls, asked about what people thought that Biden and Trump would do around abortion if they were elected in the fall. And for Donald Trump, a significant number of people thought that he would leave it to the states, which allows him to talk about the issue without talking about the specific policies that he thinks those states ought to implement. It's sort of like a little workaround from having to talk about policies that are unpopular. You can say, well, it is, in my view, it should be up to the states. And that's sort of a really smart messaging position, I think, for that exact challenge.
Well, and I'll just add that when we actually ask people, what do you favor or oppose different kinds of positions, and in this latest poll, we asked, leave it up to the states, and of course, a large majority of Republican women voters said yes. When you ask, do you think that, what about protecting, in the case of a pregnancy emergency, which has been a big issue since Dobbs in the states that have done total bans. We've heard these, some very tragic stories of women who are in the middle of a pregnancy emergency who the healthcare system hasn't been able to figure out what the law really says. That is large majorities across the board, Democrat, Independent, and Republicans say, yes, I want that to be in existence. So it's these very, as we say, nuanced ideas, and this idea that, Republicans just say, leave it to the states because I live in a state that I know is going to do what I want, or are all very popular. So it is a really smart position.
Yeah, one of the things that I found really interesting about the Biden administration and now the campaign since Dobbs is that when they would do events at the White House, and I'd go and, the vice president who's been leading on the issue for the administration, the first lady, the second gentleman, President Biden does a few less than the rest of them for some reasons. But what they do is the women they brought in the round tables were women who wanted to have children, women who did not want to have an abortion but were about to die, were septic and couldn't get one at the hospital and had to drive across state lines. And it feels like a completely different conversation that Democrats are having about who gets abortions. And, because I think the boogie woman for a very long time was like this promiscuous 16-year-old who was just out there just getting abortions at will, which was never the case. And it was always women who probably had one child and needed, for medical reasons, to get one. And so I guess, what do you guys think about that change in conversation as you're polling folks? Mollyann, I'll start with you. Is that breaking through? Are people seeing that change?
I don't know if they're so much seeing that change, but clearly the people who are planning those events are reading our polls.
Yeah. Of course they are. Who isn't? The whole poll, every day.
So, it is clearly, again, people, I think Emily just said it perfectly. The vast majority of people are in this part of this discussion. And these are the very cases that are very hard for people. And this is where it's getting really tough, particularly for the Republican Party, when you start talking about IVF, when you start talking about the mifepristone case before the Supreme Court, and where things get, where, again, the energy is more naturally with people who tend to vote Democrat, or at least the people who the Democrats really need to come out and vote in this election, the young women, the black voters, the Hispanic voters, they really need them to come out and they really need them to vote. And those are the kinds of things that really do resonate with them.
Yeah. There's been a lot of discussion, I'm a little scared, I might move over a little bit, over the years about how polling is broken. Security, are you close by? That there was something wrong with the industry. It was missing too much, especially when it comes to Trump voters. One, do you guys agree with that? And two, has the industry made the right corrections? Emily, I'll start with you.
So, you
And
know,
name names if there's some polls.
Transparency.
I think polling has faced some substantial challenges in the Trump era. I do not think that polling is broken, or I wouldn't be up on this stage talking to you about polling. I should probably be questioning some of my life choices if that were the case. You know, polls have underestimated a little bit, certainly in 2020 to a smaller extent than some people realize in 2016, the extent of Trump's support heading into those elections. However, a couple of things that I think are important to keep in mind. One is that polling is always by nature somewhat of an imprecise tool. It is not designed to pick up the difference between a 1-point margin on one side and a 2-point margin on another side, or, you know, you know, in the case of 2016, what we had was a actual national lead for Hillary Clinton, and a really complicated situation happening in the Electoral College that sort of magnified, I think, in people's minds how great of a polling miss there was in that year. But when you consider polling as a tool that we can use to understand broadly what people think about issues, about politics, about candidates, even you know, to a limited extent about the presidential horse race, but you understand that it's a tool that has statistical error associated with it, you won't necessarily, you still can understand quite a lot about what Americans think, about what voters think, about the issues, about the campaign. It's just not going to be a pinpoint accurate tool, because you can't get pinpoint accuracy from a statistical sample. You can get pretty close to accurate from a statistical sample. The other thing that I would say is that there have been some efforts to figure out, to the extent that there were polling misses, how much does that impact measurements of people's views on the issues? And the general finding has been not that much. Even if you sort of reweighted old polls, Pew did some interesting work on this. If you reweighted I can't remember if it was a 2016 or 2020 poll to the actual margin, how much did it shift the views on the issues? And it was not very much at all. So we still are getting very good measurements, I think, of how people feel about all of these issues. However, if you see 1 or 2 point differences, or even 3, 4, 5-point differences, be aware that those may not be real differences, because what we are getting from a poll is a ballpark.
Yeah. Jen, it feels like to me that what the people learned in 2016 is that, oh wait, we don't have one election. We actually have like a bunch of different elections on that same day. And so, you know, talk about the kind of information gap that pollsters have had to try to close over the years, maybe since 2016, to remind people that, like, no, we were right about Michigan and Wisconsin and Pennsylvania. You know, what was on the ground was actually correct, and what you were seeing in polling, where you saw that she was going to win the national voting, that in the national vote, she did win the national vote. She just lost in these key battlegrounds. And so, how much work have you guys had to do since 2016 to kind of fix that information gap?
I think the information gap has sort of naturally gotten a lot smaller because of what happened in 2016. It did it in 2000, and then it kind of went away a little bit. And then it came back in 2016, and it's like, oh, okay, I get it now. But I think there is also a difference between what we as pollsters see in the data in any given poll and the way that those numbers are often interpreted. And I think we could probably do a better job of communicating what we know about the certainty or lack of certainty in the data that we're getting. I think a lot of people, particularly in 2016, took the data that we were getting from those polls and, you know, came to a conclusion that things were going to happen a certain way. And you really cannot do that with a poll. You have to look at overall trends. You have to sort of look at the numbers with a little bit of a fuzzy bubble around the number to think, okay, well, this number says 51, but that could really mean 49, and it could really mean 53. And I think people see numbers and they assume that they are hard fact, but that's not really the way that it works within polling. Yeah. So I think we've made a conscious effort at CNN in particular to be more conscious of how we are presenting our polling. Since 2019, anytime we show a horse race result that is within the margin of error, we put a big yellow bar across the graphic that says no clear leader. So we are just like slamming it in your face that there's no one leading in this poll. And I think that those of us who are reporting on and analyzing polls really need to be cautious and thoughtful in our language around polling and what it can tell us, and clear with our readers and our viewers on what it can't tell us.
Yeah. Any questions from the audience yet? We have one right there.
Hello. I have a question about asking the right question. So you all talked about health care, and we know it's frequently a top 5 issue, almost never a number 1 issue, any more than getting your oil changed is the number 1 issue. But we also know that healthcare is responsible for 2/3 of bankruptcies in the United States. And I'm the former Surgeon General, by the way. And my biggest story this year, covered by the media, was me telling about how I got a $10,000 bill earlier this year for healthcare, bipartisan. And so my question is, are we asking the question in the right way? If you ask people, do you care about healthcare? No. Do you care about healthcare costs? Yes. Same thing for Latino voters. I hate that we poll, but Cubans vote Republican. Many other Latino voters consistently vote Democrat. Are we missing something by not asking the right question the right way?
Mollyann, do you want to take this one?
I think it is always challenging, wording and writing, but it is our whole career. Like, we want to ask it the right way, and we go to a lot of effort to make sure we're learning from our participants about what they really mean by that. So as I said before, like when you go the next step and say, well, you said the economy and inflation is most important. Well, what is it about the economy that bothers you? Well, they tell me it's their healthcare bills, right? It's medical debt, it's the uncertainty. So you can get that. So I guess my point is, I think you can, and many people do, ask the right questions. And the biggest thing is you can't always ask one question. You often have to ask a variety of questions. And then your second point about how there's really no monolithic group in America. We often talk about women, or we talk about Black voters, or we talk about Hispanic voters, and no one group in America is monolithic in the way they think on any issue. And the challenge for all of us is to make sure that we can continue to do the scientifically rigorous surveys that we do with enough of a sample to be able to really dig down. So for example, in today's poll that we released with 3,000 women, we got asked by a number of reporters, why didn't you survey men? And we're like, because everybody's surveying everybody, but when you do that, you can't dig down into the non-monolithic part of the women vote. And we know that women are gonna be a particularly important constituency this election, and we really wanted to be able to say, what did Black women think? What do young Black women think? What do young Hispanic women think? So it's always a fit for purpose, and it's always a challenge of balancing resource constraints against needs. But the more we can, in all of our reporting and the way we talk about it, remind people that when we talk about these groups, there aren't monolithic groups. And the more we can disaggregate them when we have the statistical power from our sample, we should do it.
I think, too, it's really clear from the data that we have that healthcare is lurking under the surface. I mentioned earlier that in our polling, healthcare as a top issue was still, top 5 was still at like 27%, which was higher than a whole lot of other issues. You also mentioned medical bankruptcies. We asked some questions recently about different types of debt. And actually the primary purpose of that poll, I have to admit, was student debt. We wanted to know about student debt, but we asked as a comparison point how important people thought it was for the government to be helping people who had different types of debt, including student debt, including medical debt and credit card debt. And it was actually medical debt that stood out on top of those as the thing that that more Americans and to some extent more Americans across party lines felt was important for the government to be working on. So that's no doubt that is an issue that is lurking below the surface.
We have one here.
To dig a little bit deeper on their not monolithic groups, but how much are you all looking at, for example, college educated versus non-college educated, urban versus rural? I'm sure there's other kinds of things like that. I'd just be curious.
Jen?
Yeah, we look at those groups in every single poll that we do. I mean, they're just central to our understanding of American politics and how people feel about the major issues that are facing the country today. So every sample that we do, it is a representative sample of the United States more broadly. The question is just whether we have a large enough sample size to be able to talk with any certainty about what a particular subset is saying. The groups that you mentioned are huge. They're major points of focus in our coverage and in what we do. So they're always there.
Yeah. Sir?
You talk about price of healthcare, and there's certainly that is a serious issue, but accessibility of healthcare is also very important. Do you ever ask those questions when you survey?
Yeah, I could just point you to the kff.org website and tell you that we have tons of surveys, and many of them are about accessing care, barriers with accessing care, barriers. I just presented some data earlier this week about parents' challenges accessing mental health care for their children and where those access problems are. So there's a lot of our work is spent on focusing on these issues. I think they kind of rise and fall on a political agenda when you're talking a lot about coverage issues. But they're always on a health policy agenda. So everything from how do you get access to your health insurance, can you pay for it? We've done stuff on the high deductibles and what that stops you from being able to access. Your even ability to get appointments. I mean, there's lots of data on all of this stuff from us and from others because it's just really too crucial to all understanding of healthcare policy.
We have a gentleman in the green here.
I got that one.
Hi there. The rain makes me think we don't hold our weather forecasters liable for what happens.
We don't.
The Bradley effect, people telling pollsters what they want to hear. Do you guys look at what you get back and then what actually happens to rethink how you ask your questions and change the science behind polling?
Emily, do you want to take that one?
Yeah, I can talk a little bit about that. So one interesting thing, so there are a couple of different things to think about when you think about that problem. One is how people answer questions about politics, about how they're going to vote. And in recent elections, there actually has not been a lot of evidence that that is what's happening. For example, in terms of, to the extent that there was a miss on measurement of Trump support, it does not seem that that was because people were lying to us about what they were going to do. One reason we know that, for example, in 2016 is because there was a ton of late movement towards Trump. People were actually late deciding towards Trump. However, that is definitely something that is happening for certain issues. So, for example, when we ask questions about race, about gender, about issues where there has been a lot of sort of societal progress in recent years, sometimes when you look at different ways of measuring that, for example, with or without a telephone interviewer in between, who people might feel is judging them for their beliefs, things sometimes are a little bit different. So that is something that people think about in terms of whether and how to ask questions to try to measure sort of latent things that people might be thinking that they might not be willing to admit to us. But this is also a real potential benefit to a move to conducting more survey research online. There are a lot of challenges to that too, including that there is no way to start online and get a random sample of US adults. You have to start somewhere else and, sort of recruit them by mail or by phone and ask them to take part in internet surveys. But that mode of interview where people are answering questions directly, they're just sort of clicking what they think is true, as opposed to answering a telephone interview, does seem to potentially get more honest answers on some questions like that.
At the risk of getting in trouble with our production team, because we're running out of time here, I have one question for you guys, and I'd like you to keep it as short as you can, maybe a sentence or one word. When you think about what's a good poll, what should these folks be looking for? Like, what are the things that make a good poll?
In one sentence?
One sentence. You have one sentence. Or we're going to get in trouble.
Okay, I'll start, and then you guys can build it. So for me, I care so much about representativeness and representatives of groups that are sometimes hard to reach by traditional methods, that I'm going to really look for the sampling. How did you find these people? I'm going to look for a clue that it was a probability-based sample so that I know that there was some statistical science around it. I am going to always look for whether it is a probability-based or non-probability-based poll before I do anything else. That is going to be my starting point of how I assess that poll and how I'm going to use that poll.
Jen?
I'm going to point to a core tenet of journalism. The most important thing a journalist can figure out is, how do you know what you know? And so with polling, it's transparency. Only rely on the polls that tell you what they're doing, how they're doing it, and how they know that it is representative of the group they're trying to represent.
Emily?
First, I totally agree with both of what these two have said, and so since they have taken both of those answers, I'm going to try to come up with something else. So I'm going to say to look closely at the way that they ask the questions that you care about. Is it fair? Are they skewing things towards one side of an issue? Are they asking the questions in a fair way that is going to allow people to answer them? And to the point of the question that was asked earlier, are they going into depth about the issues that you are trying to understand? Because there are very few surveys that can boil down one issue to one question.
Yeah. I'm surprised none of you said polls from your organization, but that's fine. That's fine. I love that.
That goes without saying.
Stay unbiased. We love that. Thank you all so much for coming to this panel. Enjoy the rest of the festival. Thank you, guys.